Join us now with more on today's pandemic headlines. Dr. Barbara Ferrer, Director of the LA County Department of Public Health. Doctor, thank you so much for joining us.
I'm really glad to be with you, Jeff and Susie. Thanks for having me.
Thank you. Well, cases and hospitalizations, Dr. Ferrer, are still very high at levels we haven't seen in months, in fact. But many experts believe we're moving closer to an Omicron peak. You've been hearing that about that a lot. Do you think we're actually close to the end of the surge?
You know, I'm really hopeful that, I don't know that we're at the end, but from where I'm sitting, it really looks like we may be plateauing. We'll know more as we look at the data that comes Thursday through Saturday, because again, this was a week where we had a Monday holiday, so we're a little bit behind on testing volumes still. But I'm very hopeful that we are plateauing. And then the good news about that is, you know, shortly after we plateau, we should start to see that decline we also desperately need. You know, plateauing at about 30,000 new cases a day, that's the highest number we've ever seen throughout this entire pandemic for a daily case number. So don't want to stay this high very long, because as you noted, high case numbers result in increases in the people who need to get hospitalized. And tragically, we're starting to see an increase in the people who are passing away from COVID.
So, Doctor, let's talk about testing, because that's been in the news. You're going to be getting some free testing. Of course, there's lateral flow tests, PCR, antigen tests, rapid antigen tests. Which ones are the most accurate, and what do you do if you do test positive for COVID? Should you get another test?
It's a great question, and I'll just simplify it and put the tests into two groups: molecular tests, like a PCR test, and antigen tests, which are those rapid tests. That we usually can get back 15 minutes, 30 minutes, we get our results. And they really differ primarily because a PCR test, you'll wait 24 hours usually to get your results, sometime a little bit longer, 48 hours. Antigen tests, as I noted, you get pretty rapidly. Both are fairly accurate. A PCR test is slightly more accurate. It can find a sign of the virus being, circulating in your body earlier than an antigen test may be able to determine that you're infected with the virus. But the antigen tests really pick up very well people who are infected and have enough virus circulating that they're likely to be infectious. They're likely to be capable of infecting others. So I think it really depends on what you need. Oftentimes, if you're feeling sick, you really want that extra sensitive test. You might wait for your results, since you have to stay home anyway, and get that PCR test. Other times, for convenience, it's very handy if you can have an antigen test because you'll get your results really quickly. Anybody who tests positive, regardless of the type of test you use, the most important thing is that you do need to isolate away from others for that minimum of 5 days. If you have no symptoms and you can get an antigen test on day 5 that ends up being negative on day 6, you could leave your isolation as long as you wear a tight-fitting, well-fitting mask the entire time you're around other people, indoors and outdoors, for the next 4 days of your sort of traditional isolation period. But it's so important for people, even if you have no symptoms, it's highly likely that for those first 5 days, you can infect a lot of other people, particularly with Omicron. So please, we ask everyone, go ahead, stay home, stay away from people in your family. Try as much as possible to be in your own room. Where that's not possible, everyone needs to wear a really good face covering so that you can avoid infecting other members in the household.
Dr. Ferrer, does the scientific community see a new Omicron, or I'm sorry, another variant, I should say, coming soon? Any talk? Have you heard anything out there?
Well, we're going to be at the mercy of a potential new variant at some point, because this is a virus, and viruses, as we've seen, mutate. With a lot of people that are still not vaccinated, not just here in LA County, where we've got about 2 million people that need to come in and get their vaccines. But across the whole world, we have millions and millions, hundreds of millions of people not yet vaccinated. That makes it pretty easy for the virus to take hold, have lots of people that it can infect. And with lots of people infected, there always will be this possibility that will have a mutation, and that mutation could in fact be very infectious. It could cause more serious illness than what we're seeing with Omicron. And it can set us back on our progress. So the most important thing would be for everyone to get vaccinated.
Well, Dr. Barbara Ferrer has joined us now. Barbara, or Doctor rather, thank you so much for your time. We really appreciate it.
No, thank you. Have a good evening.
Thank you.